Introduction. The elbow joint is a complex hinge joint formed between the distal end of the humerus in the upper arm and the proximal ends of the ulna and radius in the forearm. The elbow allows for the flexion and extension of the forearm relative to the upper arm, as well as rotation of the forearm and wrist. Articulating surfaces. It consists of two separate articulations, trochlear notch of the ulna and the trochlea of the humerus head of the radius and the capitulum of the humerus joints. 1. Humero-radial joint. 2. Humero-ulnar joint. 3. Superior radio-ulnar joint. The elbow joint has a capsule enclosing the joint. This itself is strong and fibrous, strengthening the joint. The joint capsule is thickened medially and laterally to form collateral ligaments, which stabilize the flexing and extending motion of the arm. A bursa is a membranous sac filled with synovial fluid. It acts as a cushion to reduce friction between the moving parts of a joint, limiting degenerative damage. There are many bursae in the elbow, but only a few have clinical importance. Ligaments are strong pieces of cartilage that connect one bone to another. They help provide support to your joints while still allowing for a motion to occur. Ligaments are essential for providing your elbow joint with stability while still allowing for a motion to occur. 3 ligaments are present in the elbow joint: the ulnar collateral ligament, the radial collateral ligament, and the annular ligament. These ligaments provide strength and support to the elbow joint along with the surrounding muscles or your arm and forearm. If an injury occurs to the elbow joint, any one of these ligaments may be injured. The ligament called annular courses around the head of your radius bone. The ligament helps to keep your radius in place as you rotate your forearm when you turn your hand and wrist over. The ulnar collateral ligament is a strong fan-shaped condensation of the fibrous joint capsule. It is located on the medial side of the joint, extending from the medial epicondyle of the humerus to the proximal portion of the ulna. This ligament guards your elbow against severe valgus stress or pressure from the outside of your arm. The radial collateral ligament is also a strong fan-shaped condensation of the fibrous joint capsule. It is located on the lateral side of the joint, extending from the lateral epicondyle of the humerus to the head of the radius. This ligament guards the joint against excessive varus, or inner to outer, stress. Common injuries: ulnar collateral ligament rupture, annular ligament disruption, especially after a radial head fracture, radial collateral ligament rupture, elbow dislocation, movements of joint. The orientation of the bones forming the elbow joint produces a hinge-type synovial joint, which allows for extension and flexion of the forearm. Extension, triceps brachii, and anconeus flexion, brachialis, biceps brachii. Brachioradialis, biceps brachii. The large muscle of the upper arm flexes the arm and powerfully twists the forearm, turning the palm upward. Triceps brachii. This muscle at the back of the upper arm extends the arm and stabilizes the elbow when the hand is used for fine movements. Brachioradialis, a forearm muscle that flexes the arm at the elbow. Anconeus. This muscle helps extend the forearm at the elbow. Brachialis. This muscle helps flex the elbow inward toward the body. Pronator teres. This muscle extends from the head of the humerus over the elbow to the ulnar bone to help flex the elbow, and also enables pronation of the forearm.